Paced feeding is a method that helps prevent overfeeding a baby when feeding breast milk through a bottle. This method allows babies more control over his or her intake of breast milk by taking regular pauses during feeding and responding to their cues, and may also prevent post-feeding fussiness by reducing overfeeding. As a result, the infant consumes an appropriate amount to their size and age and is not overwhelmed by the fast flow of milk through a bottle. Since much of paced feeding also mimics feeding at the breast, it can also support the breastfeeding relationship and helps babies transition back and forth from breast to bottle. Here's how to pace feeds. Hold the baby in a slightly reclined position with his head in line with his back so that his head is not turned and his chin is not resting on his chest. The baby should be maintained in an upright position. It is especially important to avoid letting the baby drink from a bottle while lying down. Such a position is associated with tooth decay and an increased frequency of ear infections. Use a slow flow nipple. Some moms find that a wide base nipple helps avoid nipple confusion. Gently allow the infant to draw the nipple into his mouth rather than pushing the nipple into the infant's mouth, so that the baby controls when the feed begins. Stroke the baby's lips from top to bottom with the nipple to elicit a rooting response of a wide open mouth, and then allow the baby to accept the nipple rather than poking it in. Keep the bottle horizontal, only vertical enough to keep milk in the nipple. Let the baby get 3 to 4 sucks of milk. Gently remove the nipple from the baby's mouth and rest it at his lips. It is important to not completely remove the bottle, as this causes some babies to stress. Sometimes a slight turn of your wrist makes it easier to remove the nipple from the baby's mouth. These pauses give the baby a chance to swallow and control the flow of milk. The pause discourages the baby from guzzling a feed. It also mimics the way milk is taken from breastfeeding. Allow the baby to let you know when he is ready for the nipple back. This can be that the baby sucks it back in, bobs his head forward to reach it, or fusses. Let the baby have 2 to 3 sucks again before the next pause. Repeat until the baby is done feeding. Allow the baby to decide when to end the feeding. Often, you will see this when the baby turns her head or does not attempt to pull the nipple back in during a pause. Watch for signs of stress from the baby, such as furrowing of the brow or widening of the eyes. What can look like a baby guzzling a bottle due to hunger may just be the baby trying to keep up with too strong a milk flow. Try to pace the feeding so that it takes 15 to 20 minutes to finish a bottle. Some babies will naturally start to pace themselves after being fed this way. It is also helpful for the mother to switch the baby from one side to the other side midway through a feed. This provides for eye stimulation and development and avoids the development of a side preference, which could impact the breastfeeding mother.